Dynamic
今
Zero-COVID
天我们邀请
Policy
到
to
国
prevent
家
and
卫
control
生健康委副
COVID-19.
主
We're
任
honored to be
李斌
joined
先
by
生、
Mr. Li Bin, Vice Minister of
国家
National
卫生
Health
健康委
Commission,
疾控局负责人
Mr.
雷正龙先
Lei
生、
Zhenglong, Head of
国家卫
Deputy
生健
Director
康
of
委
the Disease
疫
Control
情
Bureau
应
of
对
the
处置
National
工作
Health Commission,
领导
and
小组专家组组长梁万年
Mr.
先生，
Liang Wannian, Head of
请他
Expert
们
Group
为
of
大
the
家介绍相
Epidemic
关情
Response
况，
and
并
Disposal
回答
Leading Group
大家
of the
感兴趣
National
的问
Health
题。
Commission. They will
下面我们首先请
answer
李斌先生
questions,
做介绍。
and the floor is open
各
for
位
opening remarks.
媒体
Mr.
朋友
Li Bin.
大家上午好。
Friends from the press,
疫
good
情发
morning.
生以来，
Since the start of
以习近平同志为核心的党中
COVID-19,
央
the CPC
始终坚持
Supercommittee with common
人民至
vision
上
at its core
生
has
命
been
至上
put people and
着眼大
lives
局
first,
基于科学
taking
把
bearing
握
in
规律
mind the big picture
一以
and
贯
adopting
之坚
science-based
持
approach
外防输入
to
内
following
防反
the
弹的
general
总策略
plan
和
of
动态
preventing
清
case
零
importation
恐慌
and
中
domestic resurgence
2
and
年多
a
的疫情
plan
防
of
控
dynamic
实践胜利
zero-COVID policy.
发现一起扑灭一
Over the
起
past 2 years,
动
what
态
we
清
have
零
done
做
has proved that
最大
the
限度
dynamic
保护了
zeroing
人民群
policy
众
of
的生命安
eliminating
全
case by
和
case
身
has
体健康
effectively protected
最
the
大限
life
度
and health
减
of
少了疫
people
情对于
and
国家
reduced
整
the
体经
impact
济社
of
会发展
COVID
的影响
on national
路子
socio-economic
是对的
policy.
效果是好的
This is the right
是
way
中国
that has
防
yielded
控疫
positive
情的
outcome.
制胜
It
法
is
宝
key to China's victory over the virus.
今年2月底以
Since the
来
end of February this
面
year,
对
in the
传
face
播
of
性
the highly
和隐秘
infectious
性
and less
显著
detectable
增强的奥密克
Omicron
戎
variant,
变异株流行，我国疫情
China
呈现
has
点
witnessed
多
cluster
面广
infections
频发的特点。
spreading widely and
防控工作
occurring
经历了
frequently in multiple
武汉
regions.
保卫战之后最为严峻的考
China's
验。
COVID response is facing the
对
most
此，
severe
我们
test
始终坚持
after
动态清零，不
the
犹
efforts
豫，
in
不
Wuhan.
动摇。
We have never
第一
been
时间
hesitant
统
or
筹调
shaken
配
in
检测、
adhering to the
流调、
dynamic zero-COVID
转运、
policy,
隔离、
and we
收
have
治等
mobilized
力量。
the forces in testing,
最大限度
epidemiological
遏制
studies,
疫情
transferring,
扩散
and
蔓延。
isolation and treatment
目前，
in the shortest possible
吉林
time to curb the
及
spread
其
of the
他
virus.
多地
So
聚
far,
集性疫情
Jilin,
得
the
到
cluster
有效控制。
cases in Jilin and other
上海
regions have
清
been
零攻
taken
坚
under
战
effective
初见
control,
成效，
and the zeroing
全
policy
国
in
疫
Shanghai
情
has
呈
produced
波
initial
动
progress.
下降趋势。
China's COVID response
我们面
and
对的
COVID
是一
situation
场
as a
百
whole
年
has
不
seen
遇的
wave-like
传染病疫情。
decrease. We are
当前
facing
全球疫情
a
仍处
pandemic
于
unseen
高
in a
位，
century, and the
病
global
毒还
COVID
在
level
不断变异。
remains on a high
我
position,
们对于
with
新
new
冠病毒
variants popping
和
up
疾病的
all
认
the
识
time.
仍处于
We
不断
are
深化
still
的
in the
过程
process
中。
of deepening understanding
疫
of the
情
virus
带来
and the
的风险
disease.
和
The
威
risk
胁
and
仍然
threat
存在。我
still
国
exist.
是人
China
口
is
大
a
国，
populous country
地区发展
with
不平衡。
unbalanced regional
资源
development
总量
and
不足。
insufficient medical
如
resources.
果放
If
松疫情防控，
COVID response
放
loosens
任病毒传
to
播，
let the virus roam
势
free,
必会在短期
there will
内造
definitely
成大量人群被
lead
感染，
to a huge
进
number of
而出
infections
现
in a
大
short
量重
period
症
of time,
和死亡
and
病例。
then a large number
医
of
疗卫生资源
severe
将
and
面临
mortal
严
cases.
重挤兑风险，
the medical resources
大量
will
有
run the
基
risk
础性
of
疾病的
depletion.
患者、
A
老
large
年人、
number
儿童
of vulnerable
和孕妇
groups, such as people
等
with
脆弱人
underlying
群的
medical
身体健
conditions,
康
the
将
elderly,
首当
children,
其
and the
冲受
pregnant
到严重
will be
威
the
胁。
first to be
经济社会
severely
平稳
affected,
发展
and
也
so
将
will
受到
the
严重
steady
影响。
progress and the development of the
新冠
economy
肺
and
炎
the
疫情
society.
发生以来，
Since the start of
我国
COVID-19,
率先
China
控制住
has
疫
been
情
the first to control the
率
virus,
先
the
复工复
first
产，
to reopen the
率先
economy, the
在
first
世界
to
主要经济
achieve
体中实现经济
economic
正增长。
positive growth in the world major
稳定
economies.
的疫情防控形势为我国
A stable
保
COVID
持
situation
经济发展和疫
has
情防控
provided
全球领先地位
the，most favorable
提供了
environment
最
for
有利的
China
环
to
境，
maintain its economic
坚
progress
持全国
and
一盘棋，在疫
a
情地
leading
区
COVID
采取
response
局部的
globally.
严格的防疫措施，
Through nationwide
保
coordination
证全国
and
大部分地区和人群
regional
的
and
正
rigorous
常生
COVID
产生
response
活
measures,
是
we
符
have
合成本效益
guaranteed
的
the。normal life and
从
production
武汉保卫
of
战
most
到
region
常态
and
化
people
疫
in
情防
China.
控，
It is
再到迎战
in
德尔
line
塔、
with
奥密
the
克戎
cost
的全面
benefit
调精准
analysis
防控。
from Wuhan
我们
to the
始终坚
normalized
持
COVID
动态
response
清
and
零
to the
恐
whole
慌中
chain targeted
发
response
现一
to
起
Delta and Omicron variant, we have been following the Dynamic Zero-COVID policy, It has been proved that this policy is the best option for coordinating COVID response and social economic development, and it is the bottom line that China's COVID response must defend. Dynamic zero-COVID policy is not absolute zero infection. In the face of the challenge brought about by the Omicron variant, we have no capability to ensure that there will be no single domestic case, but we have accumulated much experience in fighting the virus, and we have been upgrading those measures in light of the new changes of the virus, the new situation of the disease, and in light of the different times and situations. We've been staying committed to uniting our thought and actions, implementing the COVID protocols, cementing the line of defense, and improving our capacity. We have the capacity and confidence to carry out rapid, targeted response when the virus is detected and adopt a comprehensive and holistic approach to eliminate the virus in the shortest possible time to use the smallest possible cost to achieve the maximum COVID response or prevention performance. That concludes my opening remarks, and the floor is open for questions. Thank you very much. Okay, thank you, Mr. Li Bin. And we're now into the Q&A. Please identify yourself before raising questions. Please. With CGTN, some believe that China is a vast country with varying conditions in different regions, so the dynamic zeroing policy should be compatible with different situations in different regions and be flexible. Is it possible to achieve zeroing policy in some region and coexistence with the virus in others? Is it possible? Thank you.
Thank you. First of all, thank you for your question. This is a question that both the media and the public are paying close attention to. COVID-19 prevention and control is an all-out battle. We must think more in big picture terms and coordinate our work throughout the country. Only when COVID is effectively controlled can we provide solid protection for people's lives and health and create conditions for normal production and life. Only when all localities uphold the dynamic zero-COVID policy and make effort to control local spread can we secure the victory against COVID at the national level. If individual places are not resolute and decisive enough and make adaptations, the virus may take root and rapidly spread, and they may be spillover or even cross-regional spread. This may become a transmitter and amplifier of the virus and will cause significant losses of people's lives and property and seriously affect economic and social development. So, in the premise of firmly upholding the general policy of dynamic zero-COVID, we encourage localities to explore and summarize good experiences and practices according to the local situation, and to make our efforts more scientific and targeted, and strive to achieve the greatest effect with the lowest cost. Thank you. Thank you. Next question. Thank you. Beijing News Daily. Some say that although Omicron spreads very fast, but there is a high proportion of mild symptoms or asymptomatic patients. So China is possible to adopt a lying flat strategy. What is your comment? Thank you very quick. Thank you for your question. This is a question that many are closely following. We will invite Mr. Liang to take the question. Thank you. The prevention and control strategies and measures that countries take are based on their guiding philosophy. And in the case of China, it has always been putting people first and life first. This is a people-centered and health-centered philosophy. Under the guidance of this philosophy, we have been upholding our policy of dynamic zero-COVID, and we have been improving and optimizing relevant prevention and control measures in light of the changing situations. We can say that we have protected our people against the harm of the so-called herd immunity or natural immunity. We have protected the health and life of the vast number of people and the normal life and production, as well as economic and social development in our country. For other countries, some choose to lying flat by pursuing two kinds of immunity. One is natural immunity, namely group infection, which means that a considerable number of its people are already infected with the virus. And besides, they are taking proactive vaccination measures to acquire immunity. In the case of China, our work is mainly through proactive vaccination to increase immunity and build an immunization shield. At present, there have been over 3.3 billion vaccinations, covering 1 billion and over 280 million people, covering the population in various areas and different communities. If we continue to make efforts to increase immunization rate for elderly, disadvantaged, and vulnerable groups, we will be at a better position to build a strong immunization shield. China is a vast country with inadequate and unbalanced medical resources distribution. Just like I mentioned, the vaccination rate for the elderly population is still not high enough. If we choose to adopt a so-called lying flat policy, this will greatly compromise our medical resources. And for vulnerable groups such as elderly, children, and pregnant women, it will be more difficult for them to access medical resources. So in this case, it is imperative for China to uphold the policy of dynamic zero-COVID in an unswervingly manner, while continue to optimize and improve relevant prevention and control measures. This is also our window of opportunity. If we enhance vaccination, R&D, we may grasp the opportunity. So when we are equipped with relevant conditions such as high vaccination rate, especially among the elderly population, while at the same time localities are more prepared in terms of medical resources and material supply, and there are greater coverage and accessibility of medication, and Omicron after another round of mutates become milder, and there is a lower infection rate, and that will be a window of opportunity for us to get prepared in the above respect. Thank you. Next question.
Thank you, Bloomberg News. Can we ask a couple of questions? What is the biggest lesson you've learned from the mistakes that were made in Shanghai in containing the outbreak? And separately, on vaccination, why doesn't China compel elderly people to get vaccinated like you have with students and other population groups? What's an acceptable vaccination rate for those over 80 that China would be comfortable opening up under? Thank you.
请翻译一下。
好，谢谢您的提问。涉及到
Thank you for your question. You asked two questions. We will invite Mr. Lei to answer the first question about vaccination for the elderly. And next we will invite Mr. Liang Wannian to answer the question about the lessons learned for Beijing's prevention and control. Thank you for your question. According to the deployment of the Joint Prevention and Control Mechanism of the State Council, the NHC continues to guide localities in promoting vaccination. As of April 28, 1,334,018,000 doses of vaccines have been vaccinated nationwide, with a total of 1,280,442,000 people vaccinated, and covering 91.08% and 88.58% of the total population respectively. The number of people aged 60 and above who have been vaccinated reached 226.602 million, and those who have been fully vaccinated reached 214.819 million, accounting for 86% and 81% respectively for the elder population. And booster immunizations have been completed for over 158 million people. At present, vaccination against the COVID-19 is progressing smoothly, and booster immunization is being carried out in an orderly manner, and vaccination rate of the elderly is increasing. We have carried out another round of mobilization and deployment. First of all, emphasizing on local responsibility. All places are required to understand the importance of and urgency of vaccination for the elderly, and collecting information about the elderly population in their areas, and strengthen organization and implementation. And second, give full play to the role of the relevant departments. The National Commission on Aging had issued a notice on promoting vaccination for the elderly, which provided guidance for relevant social organizations to make efforts and take advantage of their strength of close contact with the elderly and provide safe and convenient conditions for vaccination. Third is to increase publicity and mobilization. April 25th is the National Childhood Day for vaccination. And we use various forms such as radio, television, newspapers, and magazines, as well as new media and social media to reach out to communities, villages, and nursing homes to promote vaccination and increase people's initiative for vaccination. Vaccination and personal protection are our effective means of prevention and control. We hope that our friends from the media can better help us increase people's awareness and promote vaccination efforts as well as the entire prevention and control efforts. Thank you. Thank you. I will take your question about Shanghai's experience. For Beijing and Shanghai, the recent spread of cases are all due to the Omicron variant. The two mega cities all have a population of over 20 million, and given Omicron spreads very fast and is less detectable, so I think for mega cities such as Beijing and Shanghai, to prevent and stem the spread of the virus is an even more difficult task. In terms of organization and deployment, including nucleic acid tests and medical treatment, we are facing greater challenges. So in other words, this is a test to the governance capability of megacities such as Beijing and Shanghai. Shanghai and Beijing are both now actively coping with cluster of cases. I think there are several experiences that we can draw. First is the Omicron variant spreads really fast, and it is in a relatively latent manner. So we must make improvements and adjustments on our previous strategies against previous variants, which means if it spreads fast, we must act quickly and take prompt actions in order to win in this race of time. Second, we must strengthen our confidence. For example, for Shenzhen City and Jilin and also Tianjin, these cities have all experienced the spread and outbreak of Omicron. But what has happened has proved that if we take effective measures, we can control the spread of the virus and achieve the goal of dynamic zero-COVID. So we must strengthen confidence in this respect. We have the capability, we have the relevant conditions to control the spread of Omicron. We can see that both in Beijing and Shanghai, visible progress has been made. Apart from that, we must pay more attention to the vulnerable groups, including the elderly population and people with underlying conditions. For these two cities, there is a greater proportion of elderly population. This is higher than the national average. So for the elderly population, how to provide better medical services to them and increase relevant vaccination for this population group so as to ensure their life and health is an area that we must reinforce our efforts. At the same time, we must stress that in the face of Omicron, we must provide nucleic acid tests to all in need and provide medical treatment to all infected. This is a lesson and a good practice that we have learned since the initial outbreak in Wuhan. This provides us with the relevant conditions for us to cut quickly the transmission chains and to effectively provide medical treatment. Lastly, I want to mention that the battle against COVID-19 is an all-out people's war, which involves the efforts of both government departments, various sectors, the entire society, and all of us. So the fight against COVID-19 in both Beijing and Shanghai is a campaign that involves all social sectors. We must ensure that all relevant parties take their responsibility and to take more science-based and targeted measures so as to secure a victory against COVID-19. Thank you. Next question. Thank you. My question is, right now the current prevention and control measures are posing some inconvenience to people's life and production. What is your comment on that?
I'll invite Mr. Liang Wannian to take your question. Thank you very much. First, we must get this straight. That is, the ultimate goal of Dynamic Zero-COVID Policy is to provide the best possible protection of people's life and health, and to provide the best possible protection to the social economic development and people's normal life and production. This policy is in synergy with economic progress, not in opposition. It's not like this dynamic zeroing policy, the measures in this regard are to compromise economic progress of people's daily lives. This is not true. They are in synergy. The economic progress is one of the goals of Dynamic Zero-COVID Policy. It consists of 3 parts of goals. First is people's life and health. Second is effective protection of economic progress. To keep the economic progress away from the impact of the virus and the disease. Third is to ensure people's normal life. That's why the 2 parts are in synergy, not in opposition. Second, COVID-19 is the underlying reason for dragging the economy. The pandemic has surely affected the economic and normal life of all countries. The COVID response is to mitigate and eliminate the impact of COVID-19 on economic development. But due to the varying level and intensity of COVID response, we have seen different results and conditions of COVID in different countries. At the same time, we admit that some COVID response measures would cause temporary inconveniences in daily lives and to normal social and economic activities. But the dynamic zero-COVID policy puts special emphasis on targeted measures to strike a delicate balance between COVID response and economic social development. Then how can we ensure that the response measures are targeted? This requires all local governments, or governments at all levels, to take into account the different conditions locally and try their best to balance the relations between COVID response and economic and social development. And last but not least, how do we define balance? This is a dynamic process. It is under one guiding principle to achieve a balance on an evolving basis. So if we view the balance between the COVID response and economic and social development, we must see it from a macro, group-based and dynamic perspective. We must handle the relations between the short term and the long term, the part and the whole, and the individual and the whole group. So as we implement some specific measures in a short term, in some regions, some people's normal lives might be affected, or some regions' economy might be affected in a short period of time. But what we gain from this is the interests, is the normal life, and it's the normal economic progress enjoyed by the largest possible region, the largest group of people. This is the balance we're talking about. And this is the cost-benefit analysis we should do. The Chinese government has been putting emphasis, staying committed to achieving this kind of well-balance of COVID response and economic progress. And different regions are exploring different solutions to achieving such balance. Thank you. Next question, please. With Restar News, recently the National Health Commission stated that China's COVID response entered the fourth phase, namely a comprehensive and holistic COVID response based on science and the dynamic zero-COVID policy. When did this phase start, and why is the adjustment? Thank you. Thank you very much. And thank you for paying close attention to China's different phases of COVID response. Looking back on the past 2 years of fighting the virus, China has been upgrading and improving its COVID response measures and treatment plans. In China's COVID response, a people-centered approach has been implemented throughout the whole process. China's COVID response has experienced 4 phases. Phase 1, emergency response to outbreaks. We took about 3 months to secure the decisive victory against the virus in Wuhan and in Hubei. stemming the domestic transmission route of the virus. Phase 2, exploration of regularized COVID response. Centered around nuclear exit tests, we tried to control the virus within 2 or 3 incubation periods. Phase 3, a whole chain targeted response based on dynamic zeroing policy. We focus on details and basic prevention to control the virus in the earliest possible time, to use the 24 hours since the detection of the virus to control the virus within 1 incubation period. Now, China has entered the 4th phase of comprehensive, holistic approach based on science and dynamic zeroing policy. Omicron variant is highly infectious, easily transmitted, difficult to detect, and can cause a great number of asymptomatic patients. Drawing on experience of different regions, we have been improving COVID response measures. As for COVID response measures, we sort out our current basket of measures in an order of priority to put community-level prevention in a prominent position to control the populations at risk in the earliest possible time. Infected cases all be treated, and close contact all be isolated. And we tried our best to isolate the secondary contact as early as possible to cut off the transmission routes. We advanced the screening of antigen test and nuclear exit test to detect the infected cases as early as possible. Public security, public health, and information departments have worked in synergy to identify the scope of populations at risk. On organization and management of disposal of cases, we try to run faster than the virus to make sure that all processes such as testing, epidemiological studies, isolation, transferring, and community-level prevention and control be operated in a well-coordinated manner to shorten the possible time from screening check to the final patient transfer. We focus on the high-risk region to mobilize all efforts to secure victory in those regions. No matter how the virus evolves, we will always put people and their lives first to ensure the success of our COVID response. Thank you. Next question, please.
Mr. Liang Wannian, you mentioned some cities where they've already battled some Omicron outbreaks, and in those cities it has taken generally far less than it is taking in Shanghai, where they're entering their 2nd month of lockdown, and the numbers are still rising. Do you know why that is, why the situation has become so bad in Shanghai? You did mention there is a high elderly population there. And can I also ask if China has any plans to roll out an mRNA vaccine? Thank you.
你翻译一下。
这涉及到2个方面的问题。第一个方面的问题呢，
Thank you. You asked two questions as well. And for the first question, we will have Mr. Liang Wannian to answer your question. And second, for your question on the mRNA vaccines, we will invite Mr. Lei to answer your question. Thank you for your question. The COVID response in Shanghai is still in a critical stage. And also we are glad to see that from the reports of cases, it is in the process of gradually decreasing, which shows that the series of response measures are taking their effects, and it has effectively curbed the surge of cases. But right now, the infection level, the number of infections are still around 10,000 every day. Just now I mentioned that Beijing and Shanghai are all mega cities with a dense population and relatively high flow of people within the region. These all poses difficulties to our response efforts. For Shanghai, a city with 25 million population, it takes systematic and enormous efforts as well as allocation of resources for us to arrange a nucleic acid test covering the population. From the municipality level to the district level and community level, this is a whole system. And this is one of the areas that make our work more difficult. Second, it requires us to have strong capability to combat the spread of the variant. We often say that for a system like ours, for example, what kind of nucleic acid test capacity do we have to cover a city of 25 million population? This is certainly not the same case for a megacity and for a smaller city. For a smaller city, it could take less than 24 hours. Another point is that while carrying out prevention and control, we must ensure the normal operation of the basic functions of the city. And to ensure the supply of water, electricity, and the normal life of our people, we need some flow of people. For example, the delivery persons, the medical workers, as well as community staff. We do need necessary flow of people. Given that Shanghai is now experiencing community transmission, it poses higher risks for our prevention and control efforts. For a megacity like Shanghai, when it is experiencing rapid spread, can we ensure that every person that needs to be tested receive the test, and those in need of medical treatment received the relevant medical services? These all requires us to make thorough preparations as well as resources guarantee. For patients that are tested positive and for their contacts and secondary contacts, if these people still stay in their communities, it will inevitably lead to wider community transmission. This is another challenge for Shanghai. But we are glad to see that Shanghai is making progress in the above respects. Our medical services are greatly improved. Our makeshift hospitals now has an abundance of hospital beds. So the COVID response measures that we take in Shanghai are carried out in light of the local characteristics of Shanghai, as well as special conditions such as Shanghai as a megacity and the necessary flow of people. I want to point out that Shanghai is experiencing a wide community transmission since its outbreak. Compared with a single or several cluster of cases, it poses even greater difficulty for COVID response, and that is why it will take longer time. It will take longer time and greater frequency for us to conduct relevant measures such as tests and medical treatment. Next question, please.
As for the mRNA vaccine, we have deployed several R&D tests, and the fastest candidate has been undergoing 3rd clinical trials overseas, and some are under approval and review. The detail could be asked for relevant department. Next question, please. Beijing Daily. While adhering to the Dynamic Zero policy, how can we make the COVID response measures to be more helpful to reopening the economy and less impactful on people's daily lives? I'll invite Mr. Lei to answer this question. Since the start of COVID-19, we've been implementing the decisions and plans of the CPC Central Committee and the State Council, taking science-based approach and targeted approach, following the tactic of preventing case importation and domestic resurgence, and the plan of Dynamic Zero-COVID Policy. As we deepen our understanding of the virus, we adjust the COVID response measures in light of the changes of the COVID situation to better coordinate the progress between COVID response and social development. First, making our measures more targeted and science-based. We tried our best to find the close contacts and secondary contacts in the shortest possible time, shorten their stay socially, limit their scope of the virus transmission. In identifying the high-risk and mid-risk regions, we make sure that the identification process is science-based and targeted. And at community level, we categorized accurately the closed zone, control zone, and precautionary zone, and roll out specific measures in light of the specific category of regions. Second, mitigating the impact of COVID on people's normal life. In control areas, closed areas, we take note of the patients with special medical conditions and pair them up with medical institutions to make sure that those residents could live from their community and apartments directly to hospital. Also, we ensure the smooth operation of the delivery system to increase logistic support and mobilize all possible forces on a community level and volunteers to provide sufficient service and care to people in need. Third, advancing the reopening of the economy in an orderly manner. Some regions and local governments have been advancing their economic progress while observing COVID protocols. To ensure the smooth operation of transportation, we increase medical support for the drivers and strictly follow the COVID protocols such as closed-loop management, health monitoring, and nucleic acid tests, and provide set up sufficient nucleic acid test posts on highways to facilitate the drivers to taking nucleic acid tests. And also, in light of the needs of agricultural development, we provided targeted measures to safeguard the supply of agricultural products. Next question, please. With cover news, some think that Omicron variant is significantly different from the original COVID variant. And this character determines that dynamic zeroing policy is almost the same as closed management of all cities. And how can we ensure the early curbing of the spread of the virus without conducting nationwide closed-loop management and giving nucleic acid tests to all people?
Well, thank you for your question. First of all, I want to say that although the Omicron variant is highly transmissible and less detectable, and there is a higher number of asymptomatic cases, but it doesn't mean that it is impossible to achieve early detection, report, quarantine, and treatment. And it does not equal that. It does not mean that zero-COVID, dynamic zero-COVID equals nucleic acid tests for the entire population and closing of all cities. To be more specific, what kind of strategy do we need to take in terms of conducting nucleic acid tests? Now we are deploying a nucleic acid test plus antigen test strategy, and this will also be adjusted in light of the changing situations. Overall, the earlier we detect the cases, it is easier for us to identify the transmission routes, namely where the virus comes from and what kind of contact there is. And there will be a more precise and targeted area for tests and control. That means if we do a good job in early detection, reports, quarantine, and treatment, we will have greater precision in terms of prevention and control. We do not need to adopt measures on a wider scale, but in a more precise and targeted area. This is very important. You have asked about whether we can achieve the goal of effectively contain the spread of the virus without nucleic acid tests for all and closing of all areas. My answer is we can achieve this goal, but we need relevant capabilities and mechanisms and relevant cities and regions need to be well prepared. Whether there will be a rapid response mechanism and whether there will be high awareness and alert in the population for the spread of the virus all determines whether we can achieve early detection, report, quarantine, and treatment. When it is hard to identify sources of infection and the coverage of infection, given that Omicron spreads very fast, for Omicron R0 rate is almost 9.5 days and is mid-level incubation period is just 3 to 4 days. It is highly infective and spreads really fast. So in this case, if we cannot easily identify the source of the virus and the scope of transmission, it is necessary to expand our work to a bigger area, enhance our work in nucleic acid tests and other relevant prevention and control measures. Overall, China is equipped with the relevant technologies and approach to achieve the early detection, report, quarantine, and treatment. For example, we have a sound testing system, and we have a testing approach combined nucleic acid tests and antigen test. We have a report system to identify infections. And also we have relevant specific regulations and legislation on the reports of COVID cases. And more importantly, over the past 2 years, we have accumulated many experience in fighting the virus. For example, our emergency response system, our public's participation, and the interagency coordination in the fight against Omicron. One of the basic experience that we have accumulated is that we must take quick action against the quick transmission. This will help us to defeat the virus with the lowest cost. Thank you. Next question, please. With China Daily, there are reports of difficulties in accessing medical services in some controlled areas. How can we ensure both prevention and control and regular medical services? Thank you for your question. Coordinating prevention and control and regular medical services is crucial to maintaining people's health. Amid prevention and control efforts, ensuring normal medical services and maintaining its continuity is always our most important concern. At present, the national COVID situation is still marked by spread and cluster of infections in multiple regions, and the situation is still serious and complex. Some areas are under control due to the spread of the virus, and public access to medical services is affected. In response to this, the National Health Commission has put forward clear requirements and made comprehensive deployments and detailed guidance to different places, which are now taking practical and effective steps to protect people's medical needs. Our work is mainly in the following 4 areas. First, to ensure rescue and treatment of patients with acute and critical illness. The NHC has asked relevant localities to designate hospitals that admit patients with yellow health codes, and for patients in critical and serious conditions with unknown nucleic acid test results, we set up a buffer zone for their use of emergency rescue room, operation room, and wards. Medical staff strictly implement the first consultation responsibility system and provide timely and effective rescue for these patients while ensuring their personal protection, and they must not refuse or delay treatment for any reason. Second is to meet the medical needs of special groups. And for patients with hemodialysis and radiotherapy needs and other tumor patients, as well as women in labor and newborns, the local prevention and control department put efforts into identifying, collecting, and sorting out the number of these patients and their needs so as to ensure continuous medical services. For long-term medication needs, for people with chronic diseases, long-term prescriptions are issued so that primary healthcare institutions can meet their demand. And third is to improve medical guarantee for affected areas. We have increased coordination at higher levels and between departments and strengthened service channels, including the 120 and other emergency hotlines, to ensure that people in times of emergency can get through, find help, and receive medical services. And for closed and controlled areas, we will continue to improve the operation mechanism in emergency situations, arrange expert teams to provide consultation and assessment, and provide door-to-door closed-loop transfer for those who need to go out for medical services, so as to ensure that residents can leave their residence compound and enter the hospital. And fourth is to coordinate COVID prevention and control and medical services in medical institutions. We have strengthened monitoring and early warning system and improved the process of handling emergency outbreaks. Once a confirmed case is identified, an emergency plan will be activated to ensure timely and orderly handling while reporting to local departments. And for medical, we will coordinate efforts in prevention and control in medical institutions and in community levels. For institutions where cases are found, we must not resort to simply shutting the place down. And after putting the place under control, we will effectively activate the emergency response mechanism to guarantee the continuous operation of key departments, including emergency treatment, ICUs, and delivery rooms, to minimize the impact of prevention control on regular medical services. Thank you. Next question, please.
Thank you. I'm from the Straits Times. I have 2 questions. You've emphasized that the costs and benefits of your dynamic zero policy should be calculated on a macro level. Where is that tipping point where the costs outweigh the benefits, and what is that cost? My second question is, China has had a head start in recovering from the pandemic and to find new strategies to deal with an evolving virus. But what have you done to build up healthcare capacity since the pandemic started 2 years ago?
涉及到两个方面的问题。这两个方面的问题呢，还是请我们梁文年院长呢。
The two questions will be answered by Mr. Liang. Thank you very much. As we calculate the cost and benefit of fighting COVID, first we must make clear of the relations between the part and whole, the short term and the long term. So this requires us to take a systemic, a long-term perspective, a comprehensive perspective of the cost and the benefit. When we assess the cost and benefit of fighting a disease, it's not only about money or economic development, because life is priceless. This is known to all. It cannot be valued by money. So we must do the math in a comprehensive manner, on an involving basis. We must think about economic cost and benefit, and also cost and benefit about people's lives. Indeed, there are costs in implementing COVID response, including direct costs like vaccination, the construction of mobile hospitals, nucleic acid tests, which need a huge amount of investment of human capital and money. Also, COVID response incurs indirect cost, like the impairment of flow of personnel in some regions, in some sectors. And such stem of flow of people and goods will cost the economy. And then there are invisible costs. For example, the isolated population, or those living in control zones or precautionary zones, they may have some psychological fluctuations, anxiety, worry, concern. These are the invisible costs. These are the three aspects of costs. But at the same time, on the other end of the spectrum, there are benefits, multifaceted benefits, like direct benefits, indirect benefits, and even invisible benefits. China's strategy of preventing case importation, domestic resurgence, and the dynamic zero-COVID policy have effectively avoided the massive outbreak of the virus and protected people's life and health. And avoided the decrease of life expectancy, safeguarded and ensured the normal life and production of the largest possible region in China. These are the most obvious manifestation of China's direct benefits from the COVID response. Other speakers mentioned China's economic achievements in the past 2 years, like China was the only or the first major economy registering positive economic growth. The 2-year average economic growth rate was 5.1%, and one of the leaders in major economies. And the Q1 economic growth was 4.8% in 2022. China's COVID response befits China's national conditions and strikes a very good balance between COVID response and economic progress. Due to the uncertainty of COVID, in essence, China's COVID dynamic zeroing policy is like buying an insurance to countering the uncertainty brought about by the virus. And this insurance has been bought for all 1.4 billion Chinese people. And the cost of such insurance is to compromise a small amount of consumption of a small amount of people. But the aim is to achieve the maximized benefit and welfare of the whole society. Not to mention, the dynamic zero-COVID policy has also contributed to the development of China's digital economy, provided people's lives, provided protection for the vulnerable groups, and improved the governance capability of local governments, and contributed to the synergy of public service departments. Across all levels of China's government, such synergy has only been strengthened as we fight COVID. These are part of the indirect or invisible benefits we gain from fighting the virus. Medical treatment and prevention has always been an important part in China's COVID response. And over the past 2 years, we have been strengthening our capacity to treating and receiving all patients in need. We have done mainly the following aspects. First is to strengthening the management of targeted hospitals to fight COVID. We target those advanced, highly professional hospitals as targeted hospitals to treat COVID patients, and have specific provisions about the number of beds of those hospitals. For targeted hospital in big cities, they must have no less than 500 beds, and for bigger cities, the number of beds must be no less than 1,000. And for cities even bigger, the number of beds must be no less than 1,500. And the number of beds treating severe cases cannot be less than 10% of the overall number of beds of all those hospitals. And there must be backup hospitals in all regions to fill the void or the insufficient number of beds when outbreak occurs. Second, rolling out multifaceted treatment plans and rolling out plans to set up mobile hospitals to make sure that the patients could be received to hospitals in no more than 2 days. And by April 25th, there are 400 mobile hospitals under construction or being completed. And we have also have specific provisions of other procedures and details of hospital management. We have also revised COVID protocols and tried our best to increase the use of beds in hospitals. And we have also offered guidance for local hospitals to provide COVID treatment as well as normal medical services. We have also strengthened capacity building for ICU, equipped those with equipment and facilities needed, also strengthened capacity building for medical personnel, expanded the use of TCM, increased emergency treatment, and plans and drills accordingly, and also increased material reserve. In the interest of time, last question, please. With Shenzhen TV, we noticed that the WHO recently stated that the COVID-19 pandemic still constitutes a public health emergency of international concern, and a new wave might outbreak in autumn. What will be China's targeted measures to the possible autumn outbreak? Thank you very much. I'll invite Mr. Lei. We also take note of the statement of the 11th meeting of the WHO's IHR Emergency Committee, saying that the pandemic still constitutes a public health emergency of international concern. China pays close attention to the global COVID situation and the measures taken by the WHO and other countries. And we have been improving China's response measures accordingly. Respiratory diseases are intense in autumn and winter. Since 2020, in light of China's COVID situation and the variant of the virus, we have been guiding local governments to improve early warning system and monitoring of the virus, increase the capacity building in early assessment of the risk of the virus, and strengthening prevention control on key procedures to take a holistic approach of the prevention of COVID and other respiratory infectious diseases in autumn and winter. We'll keep a close track of the global COVID situation and increase our guidance in light of the COVID situation in China to make sure that we can have a safe winter and autumn. That concludes today's press conference. Thank you very much.